Recently, I was looking at the studies for ALA, which is one of the omega 3s, and improving cholesterol numbers. And basically, the studies are still mixed. They're kind of 50-50, and I would guess would have to do with gut microbiome and absorption of ALA. And this is in human studies. Some show that, it does improve cholesterol numbers, and some even show that it could reduce the likelihood of cholesterol blockages in your arteries. But then other studies show that it didn't make a difference at all. And so I'm guessing when the results are so mixed like that, it's probably related to the absorption of different people, different gut microbiomes absorbing ALA differently. And so if you wanted to try it, recommendations I saw, there's not official recommendations, but some I saw said, 1.1 grams of ALA for women per day and 1.6 grams per day for men. And that's one recommendation, kind of a ballpark to try if you wanted to try it. And I would recommend that, you get your cholesterol checked and then you try it for 3 to 6 months and then get your cholesterol checked again and see if it made a difference or not. If not, you may be, one of the people that it's not going to make a difference in, and then it may not be worth, continuing to try it. Basically, some of the mechanisms of how it could potentially work based on the animal and in vitro studies is, it could have antioxidant effects, it could have anti-inflammatory effects, potentially it could help improve your blood vessel function, and it could reduce the oxidization of LDL cholesterol. And so those are some of the ways it could possibly work based on the studies. But still, there's not a clear answer, so it's something you could try, but if it doesn't work out, I wouldn't continue it. There aren't really that many side effects. They're mostly gastrointestinal or digestive, but there were a few studies questioning if there is an association with the development of prostate cancer or risk of prostate cancer. So you should definitely discuss it with your primary care provider first to see if you have any other risks for prostate cancer, if that's an issue for you. But otherwise, I think it's worth trying, once to try to improve your cholesterol numbers if that's something you're working on.